So bone grafting for implant dentistry is somewhat routine in your practice.
It's very routine. I mean, put it to you this way, with the 3D technology, we can many times avoid having to do a bone graft.
The 3D technology.
With the 3D technology, that means we take a scan, a 3D of their mouth. We are able to see areas where bone is, and we can use that as opposed to doing a bone graft. Now, in those cases where bone graft is necessary, because there are cases that bone graft is necessary, it's really not a big deal. Bone grafting is very routine.
And like you mentioned, that you're doing less and less bone grafting. Is it because of technology?
Yeah, well, with technology, with advances in technology, with the 3D technology that we have, we're able to...
Like you almost don't need it most of the time?
We're able to take that 3D scan and we can locate exactly where the bone is, or exactly the areas that we have to stay away from, right? And we're able to locate the areas and we can place implants there, and we can many times avoid having to do a bone graft. But if we need to do a bone graft, it's very routine. It's really not a big deal.
It's like synthetic material, or what is it?
There are different choices. There is synthetic bone. There is bone that comes from animals, which is bovine origin, or there is also bone that comes from a bone bank.